with the House plan, but I can see how it fits very well if the Healthy Utah goes first. Their concern seems to be one of sustainability. Can we continue to afford it? And there are other issues. Will we be able to pull it away from somebody? Once we've given them this benefit and pull the benefit away from them, they hearken back to vision and dental of Medicaid in times past. The good news, though, is that we've got an agreement with the Department of Health to allow us to grandfather people. So if you sign up with Healthy Utah, and again, the good news, at least the process is, you have to sign up acknowledging this is a pilot program. It is temporary in nature. It can be modified or eliminated. So when you sign up, you know this up front. People going with their eyes open. You don't like it, don't sign up for it. But then those people who sign up will be grandfathered. By the way, most people are on Medicaid on average about 6 months. It's a temporary program. So the hope is that just like we did with pension reform, it was not sustainable, we didn't think, so we had 2 tiers. So those who sign up on Healthy Utah will stay and be grandfathered. They will, by attrition, fall off. We'd go to the Dunnigan plan, which they believe is more sustainable. And again, through attrition, we actually cap the expenses. You don't have the runaway expenses, and you never jerk anybody's rug out from underneath them on the coverage. Seems like an answer to the questions and concerns that the House has raised. I'd like to have that discussion with them and say, what is it about this that you don't like? Because it seems like it answers your questions.
So you said several times during the course of this, if we don't have any of your state of the state, that doing nothing is not an option. It looks like now that's the most likely option. Where do you go, assuming we reach midnight Thursday without anything on the table?
Well, I'm hopeful that we'll have something. Again, I think doing nothing is the worst of all the options. Certainly, I don't think it's an option for me. And again, I've heard discussions before the legislature started that it wasn't an option for the House or the Senate. So I'm hopeful that we can find something to do. Doing nothing is the worst of all options.
What else is on the table?
Excuse me?
I said, if nothing does happen by midnight tonight, you're open to calling this a special session later.
By midnight Thursday night, you mean?
Yeah.
Yeah. I think all the options are on the table. I expect that, we would continue negotiations, discussions, and hopefully find that compromise point that everybody can feel good about. It's clear where the public's at. The public wants to see us resolve this issue and get a solution. But, I'm optimistic that before midnight Thursday night, we can come up with a resolution.
But if nothing happens, what will you do?
I don't know.
Governor, what room do you have to maneuver, though, in terms of negotiations? It seems like you've given quite a bit on Healthy Utah throughout the session. You've actually proposed a compromise that includes the House plan. What is left for you to do in terms of getting the House on board?
Well, you're right. We've made a lot of modifications from the original Healthy Utah proposal. That's why we now have one that's called Healthy Utah 2.0. We've tried to address all the concerns that the legislature has come up with, particularly the House, other concerns out there in the marketplace, to try to address them. I think we've addressed every one of them, frankly. And so we're just trying to appeal to the people's logic and reason and see if we can't, in fact, come together on what we believe would be a good pilot program that does have the ability to be sustainable if we decide to continue on with it. We'll have a new view of the landscape after 2017 to see if there's new politics involved, that we can use that to adjust our trajectory. And we've got this grandfather capability so we don't pull anybody off the system, to jerk the rug out from underneath them. So, we're going to continue to talk and hopefully explain maybe better so that people can understand. I hope we're not in a position where people are saying, my mind is made up, don't confuse me with the facts.
But the House held on to their own bill and did not send that over to the Senate, so it could be dealt with there. What do you make of that? I mean, is that a signal that there is no room for compromise?
Well, it's certainly not the process that we would expect. Again, as I said before, in the very beginning, the process does count. How you conduct yourselves, make sure that there's openness and transparency, so that there can be hard questions asked and answers given. We can amend, modify, improve bills. That's the process. So you'll have to ask the House why they're not sending it over. I don't know what their motivation is for not sending it to the Senate. That's a question you'd ask the House.
On public support, Governor, supporters refer to polls that show Healthy Utah is preferred by the people of Utah. But you hear from the House arguments that when they poll their own district, well, House leadership anyway, when they poll their own district or when they're at town hall meetings, they gather the opposite. They also argue that it's impossible to get a poll question to truly define the complexity and really get a feel for where the people of Utah stand. What's your response to that?
Well, I trust Dan Jones. I think if we're going to look at a pollster, let's look at Dan Jones. I think letters that people send out to their constituencies sometimes are push polls and probably not. If you can't trust Dan Jones polls, why could we trust somebody else's made-up poll with a letter? I think that's probably disingenuous if we don't understand the polling. I would be the first to admit that this is a complex issue, and I expect that all the details the general population does not understand. But we have the business organizations who've studied this in depth, different associations who've studied it in depth, the providers who've studied it in depth, many people out there who are experts in Medicaid and health care have studied it in depth. These people have weighed in and have said, we've studied it and probably understand it as good, if not better, than most of the legislature. I mean, these are experts in the field. And how hard is it to understand that we've passed a law that most of us don't support, that the expansion of Medicaid is voluntary, granted, but the taxes are mandatory. We're having to pay for this program. So the question is, where do we get the best bang for the Utah taxpayers' dollars? We can either let it languish in Washington, D.C. and be spent elsewhere, or we can bring back the $350 to $400 million that comes just the first year and spend it on private insurance in the private sector, not only helping get better coverage, better options for the recipient, but infuse it into our own economy. I mean, that's a concept that's not hard to understand. And I think that's why you see such broad-based support. The concept of saying we're paying for it, we ought to find a better way to effectively spend it, and the Healthy Utah plan effectively spends it better than Medicaid, and certainly better than any other alternative. That being said, I will be the first to admit that Healthy Utah is not a perfect program. But I'm here to tell you, it's better than any other alternative out there. From doing nothing to doing something in the middle to Healthy Utah. It is the best program out there that respects the Utah taxpayers' dollars and benefits the most Utahns. And not only has a benefit of health, but helps them get off the government rolls by having a work program that they get involved with. I mean, this really is a conservative thought of saying, let's not waste the taxpayers' dollars. Let's get the best bang for the buck we can out of what we're being charged.
If we got a Healthy Utah 3.0 by midnight on Thursday, how fast are you ready to get that rolling through the health department?
Immediately. Whatever we need to do, I'd go back to Washington, D.C., meet with Secretary Burwell and finalize the details. We're ready to move as quickly as possible. So again, I'm hopeful that we can resolve this issue. I think it's certainly on everybody's mind. You wouldn't be asking all these questions if it wasn't.
But you had I think a 3-month or 4-month lag time between passage of Healthy Utah and the actual.
Yeah, there has to be a transition period, to get into it and ramp up. There's some time that it takes for us to actually implement the program, but we would start immediately. The longest journey starts with the first step, and we'd take that first step immediately after the session's over.
Governor, speaking of polls, UtahPolicy.com, Dan Jones has a new poll out that says, in general, when there's disagreement among the Republican government and Republican legislature, who do you agree with more, the governor or the legislature? The governor, 48%, legislature, 21%. It doesn't mention Healthy Utah, but you think this is reflective of the public supporting what you're trying to do here?
Well, I expect it's a reflection of the fact that on these issues that we've been have a little higher profile, and we try to govern with a common sense approach. I mean, most of the stuff we're talking about is just kind of common sense. It doesn't have to be ideology. It doesn't have to be partisan. It's just the common sense reflection of what the people of Utah want us to do. We're here to solve problems, not to kick the can down the road. Take on the big hard issues and see if we can't come together and be responsible to those who have elected us. And that's the goal. That's the intent. That's what we're trying to do in the governor's office, and I think it's reflecting well in the public.
There was a big noisy row here yesterday on the education funding. Teachers and others demanding 6.25% of the proposal. That legislature seems to be stopping at 4 and saying this is as good as we can do. Are you satisfied with the 4? Is that?
No, I'm not satisfied with the 4% WPU. I think that it should be higher, and that's why I proposed 6.25 and provided a way for them to get there. I not only included with the higher WPU, which is really how you fund education, but I also included the need to have the local districts make those decisions. You know, every district is not the same. They have unique demographics and unique challenges, and they know best how to spend the money. Whether that's higher teacher salaries, whether that's smaller classrooms and hire more teachers to reduce the classroom size, whether that's putting money into technology, professional training. I mean, all those things that each school district says, this is what I need uniquely so for my school district. That comes with having a healthy WPU. So I'm not satisfied with the 4%. I wouldn't have proposed a higher number if I didn't think it was important. That being said, I appreciate, what they're putting out there. It's, we're over $400 million. We can do better.
Legislators say that part of the reason they weren't able to get to the 6.25 was that you took $94 million out of roads in order to get there. And at the beginning of the session, they took over $110 million, a little more than that, out of the surplus because they were afraid things were growing too fast. That money is still out there. They've allocated it into a number of reserve funds. It's ongoing money. They put it into building maintenance. Why not go after those funds?
Well, again, you're exactly right. They took $116 million off the table, saying that we were too optimistic about the growth that's taking place with our economy. Now, the fact of the matter is, as you develop consensus numbers with the executive branch and our Office of Management and Budget, working with the legislature's fiscal analysts, all of those things are taken into account. And it's the Art Laffer, Ronald Reagan's economic advisor, says the economic outlook for Utah is the best in America. The latest one that just happened is the National Association of Realtors, who has a significant department with their chief economist to try to project what's going to happen to the economy and interest rates going forward, said at the end of their presentation in Chicago here about a week and a half ago to 1,500 realtors from around the country, said that the state that has the best economic outlook for the next 5 years is Utah. So we've tried to incorporate all the ups and downs and the trend lines and all those things and say, here's what we expect the economy to grow. To take $116 million off the table certainly puts a wrench in the gears as far as how much have you got to divide up, and that will certainly impact education or transportation or health and human services or any other issue out there. So there's probably more than one way to skin the cat. I said, why don't we take the earmarks off of transportation? Most everybody now is talking about that's probably not good policy. We need to take it off at least at some level. And we've said you can take off, follow my budget recommendations, and not lose one road project that we've got on the books today over the next 4 years. And we can make some adjustments over the next 2 or 3 years as we look to maybe increase the funding for transportation, whether a sales tax or a gasoline tax increase. These things can be adjusted. So there's a way to do it. It just takes the political will, I guess, to do it.
So you don't like the 4% WPU, are you gonna live with it?
Well, we're going to continue to negotiate with the leadership in the House and the Senate and see if we can improve it.
If they don't, will you veto the budget?
Well, we'll have to wait and see. I don't know that that's something I want to do, but again, I'm optimistic that we'll find some trade-offs here and there, and we'll make sure that education gets a significantly large number to education. And I would note it's at $420 million now, so that's a pretty significant number. It's not the number I like. It's not the number we should have. It's not the number we're capable of having. But, let's not sneeze at $420 million either.
Governor, last night there was a motion in the House to increase the WPU from 4% to 5%, and that failed. How optimistic are you that we can align the budget closer with these priorities that you've identified?
Well, I'm hopeful. Let's put it that way. I'm just hopeful. Again, I think everybody understands my budget priority number one has been education, because that's the key to having long-term economic growth, which is my number one focus. And I think the House and the Senate understand that too, and so we'll work together. There's, a lot of needs and a lot of demands out there and areas of concern. A lot of heavy lifting going on in this session, maybe more so than any session that I've ever been around in the last 10 years. more big issues, more heavy lifting, more emotion, all in this session. And it makes it sometimes a little difficult to get it exactly right. But we're going to continue to work. Our door is always open. We're going to continue to communicate, discuss, dialogue, and see if we can't all come together by midnight Thursday night.
Gas tax, there's talk, the negotiations between the Senate and House right now on how to structure the gas tax. From your seat, your involvement in those talks, what would you oversee? What should be?
You know, I think the idea of a combination is not a bad one. I think we need to have some instant help now. We're falling behind not on just building of roads, but on the maintenance of the roads. We ought to be very cognizant, if we're gonna build them, we need to maintain them. And that's an area we're falling short on. So having, you know, a 5-cent increase in the gasoline tax so we can have some instant infusion of money into our needs for roads is a good thing. Having it indexed, having a sales tax that will grow as we have expansion of the economy and address our growth pressures is also a good thing. So the combination of both those, which I think is what's going to happen, I applaud and I support.
What about the local option tax? That seems to be holding that up a little bit in the Senate. I don't think they signed off on that piece.
Yeah, I know the local people really like it, and there's probably some good reasons for that. I like local control. I come from local government. There is some concern about losing headroom. If you give it to the local people, then if the state needs to adjust it, then that's kind of been taken up. And so the loss of headroom is a concern. There's also a concern about one community does it, another community doesn't, so you have a little bit of a hodgepodge around the state. It disproportionately probably hurts the rural people if they have to keep pace. It costs more, and they maybe have less to benefit, and they have more roads, more miles of road to travel because they're in the rural parts of our state. So there's pros and cons without, being rushed through very well.
On the Healthy Utah funding, there was talk that if there is some kind of compromise, and obviously that would have fiscal note either way it goes, that money would have to come out of something that's already been allocated, probably social services programs. Do you see it that way? Does that money have to come out of another program that benefits Utahns?
Well, one of the reasons we tried to go the 2-year pilot program is so we don't have to have any kind of a tax increase, and we can use it out of existing funds. And the first year, we really don't have to come up with anything. I mean, that's, again, the fiscally prudent way to go, I think. And at least that's my argument and my opinion. Clearly, if we go with the Dunnigan plan, where you have to start out with $35 million and go up to $77.2 million over 2 years, that money does have to come from somewhere. Now, you could take it out of the rainy day fund, at least initially. Where their ongoing funds and what the revenue source is, I'm unclear. It's a little bit incomplete when they say to us, well, this is our program, okay, how are you going to fund it? And they say, well, we'll find a way. So I don't know what the specific program they've got in place, but I expect that if there is a will, there is a way to do this. Again, I just think that Healthy Utah is a little more fiscally prudent way to go about it.
And so it doesn't have to hurt other Utahns that need to fund one.
No, I think I think there's enough resources out there, take a little bit here, a little bit there, and put it together. We can make sure that we have a very prudent budget that balances the needs of the people of Utah, reflects their will, and really judiciously uses the monies that we have available to us in reasonable and responsible ways.
Yes, I have one more.
Healthy Utah's been around for a long time. I mean, this isn't a new deal. You were talking about calling a special session last summer. How frustrating is it that we're at the end of this 45-day session, there are 2 days to go, and they still haven't done anything about it?
Well, it's frustrating, but it's not just frustrating for me. I expect it's frustrating for the public, for the people of Utah that expect us to come up here and solve problems. I also expect it's frustrating for the Senate, who did a lot of good work, in modifying, amending, changing the bill to come up with something that would be, they thought, satisfactory to members of the House. And I expect it's in some ways frustrating for the House, that they can't seem to convince the rest of us that their way is the right way. That's part of, the making of sausage up here. It really is a little bit messy sometimes, and this has been probably a little bit messier than any of us thought in the beginning of the session when it comes specifically to the Healthy Utah. I hope nobody takes it personally. We shouldn't waste time on the personalities and taking this as a personal affront because somebody disagrees with our approach and with what we think is maybe the best way to go. So again, I think everybody's frustrated on this because we're not solving the problem. And my hope is that we will in fact solve the problem in the next 2.5 days. And if we don't solve it in the next 2.5 days, it's not going to go away. The problem's still going to be there. We're going to have to solve it sometime, and we can't just keep kicking the can down the road.
Thanks, Ken.
Thank you, Kevin.
Thank you.